Hello everyone. First go through this football jolly video clip and then we will proceed. Okay, everybody knows that our journey starts from fetal life. Everybody was in fluid, I mean amniotic fluid, for almost 9 months. When we came out, it's a very short and rapid struggle to live in this air-filled environment. I repeat, we came out from water-filled, fishy environment in our mother's abdomen for almost 9 months and came out to breathe the air-filled atmosphere of this world. This is not only for humans but also for the entire group of mammals. Nobody is out of this at this moment. I'm going to give two questions, even if many of us would know the answer. First question is, what happens to the fetal cellular system during parturition? I mean during delivery. I'm giving four options. Please go through that. One is, fetal cells, do they undergo aerobic system in the cellular cycle, or do they undergo anaerobic system in the cellular cycle, or is it both, or none of the above? The answer is both. Most of us undergo aerobic system in the cellular cycle, and there would be some anaerobic system in the cellular cycle for some time. It could be either many seconds or few minutes during delivery, especially in the second stage of labor when we are coming out of the mother's home. This happens in the normal pervaginal delivery. This does not happen in the babies delivered by cesarean section. It means that those babies may not undergo any anaerobic system. Is it good or bad? It's good for the mother, but not at all to the newborn babies, because they will have immature lung system due to the less innate immunity. So they will have high risk of asthma and many infections, especially bronchitis and something like that. So those babies and children or even young adults would be visiting pediatricians or pulmonologists or general physicians, especially till their puberty. The second question is, which system would have been stressed or shattered more for the baby's life situation after delivery? Everybody knows the answer. It's the respiratory system. Especially heavy loud cry of the baby indicates that all of them are almost intact. All of them are happy. The physician, the pediatrician, the mother and the relatives are all happy, but when the baby is crying. Antenatally, the entire human system is filled only with fluid, having no air at all. Even then, everybody is in development, including the nervous system, cardiovascular system, lymphatic system, with fluid-filled gastrointestinal, genitourinary and respiratory systems. I mean, all of us were breathing through water like a fish. We were also drinking fluid during that time, and we were also passing urine all during our pregnancy. After delivery, two systems have changed dramatically. First one is the drastically changed respiratory system, which is completely replaced by air in every millimeter of lungs within few days. Same way, some air being swallowed, partially filling the gastrointestinal system, because we swallow some air while drinking milk. So everybody should know this background, whether you are delivered either normally or by cesarean section. Now, what happens to the baby's system just after pervaginal delivery? It's the same when we are diving in the swimming pool if it is filled with cold water. Here the baby is in the second stage of labor, who is diving from hot water in the mother's womb, coming to breathe cold air in the world. There is some reflex due to the enormous change. This is called as diving reflex at birth. This is there is triplex of decreased respiratory, cardiovascular and nervous systems. I mean that the baby undergoes transient apnea, bradycardia and increased peripheral vascular resistance. This is controlled by the central chemoreceptors in the medulla oblongata and also by the peripheral chemoreceptors in the carotid bulb and in the aortic arch. That's why most of the normal deliveries are going through cephalic presentation. But even in adults, if you're going to dive in a very cold swimming pool, dive such a way that your head be wet first to tackle the same diving reflex. Due to the diving reflexes, there is incidence of sudden infant death syndrome even in normal babies, which had been more especially before 1950s, when the newborn baby had been handled with cold hands or sometimes cold air and cold water. The incidence was between 1 in 100 during that time. After knowing these facts, it has been reduced to 1 in 1000 now after 2012. And especially the baby's head is not in proper position. And our goal now is to reduce to 1 is to 2000 of newborn during 2030. That's why now we are having more cesarean sections, and this might increase every year. In toto, we know that we all came from fluid to air concept from pregnancy, not only until delivery but after that. During our live birth, our central nervous system and cardiovascular system struggled a lot to make our respiratory system to survive through this aerated atmosphere. Immediately after delivery by Apgar score, we see the respiration, pulse rate and the activity to assess the lungs, cardiovascular system and the nervous system respectively, and the rest being appearance and the grimace, which might be due to the temperature and toto of all. By this immediate big flow transformation of fluid to air concept, we survived due to the reflexes from cardiovascular and central nervous system and to make our first breath in the air-filled atmosphere. Now our life starts from babies to childhood to school age to college and then to junior colleagues. By 30s to 40s, we are stable and almost settled and then become as senior colleagues within few years and finally come to old age. But even now, babies in old age are highly dependent on others to live. Remember, our life in this world starts from our first breathing, right? Our first breathing is very, very important and everybody knows. But after that, breathing is considered as least important one. To know the real facts, we still have to go to the basics now. Genongs is one of the best physiology books during our MBBS. And even in that book, in its 25th edition in the year 2014, it is said that the respiratory system is largely unchanged by training, but it was modified in the next 26th edition in the year 2019 and said that it can lead to significant adaptation that enhance the respiratory efficiency and endurance. I think its meaning is that the respiratory training is of less significance than muscular or aerobic or anaerobic training. I don't know, is this right or not? Let's analyze and come to the real conclusion. In normal individuals, air is inhaled and exhaled routinely. Not all the air inhaled is not being used into our body, and this is called as air of dead space. The air in the nose, nasopharynx, larynx and the tracheobronchial tree, and that is called as anatomical dead space because it's not used. And the air coming into the lungs but still expelled without going into the circulating system into the body is called as physiological dead space. In a normal 65 to 70 kg man, he inhales almost 6000 ml of air by inhaling 500 ml of air by each breath with 12 breaths every minute. Now of 6000 ml, 70%, I mean 4200 ml goes to the circulatory system and is being used, whereas almost 1800 ml of air is unused and it is called as dead and exhaled without any use. In such normal individuals, their resting heart rate will be nearly 70 to 75 beats per minute. Now we will go to the athletes and swimmers for many years and see what happens to them. Here they breathe the same volume of 6000 ml per minute, and now it's almost the same as the normal person. And this volume is called as the tidal volume. I mean the tidal volume is the same for both in normal individuals and in athletes. But the difference here is that the athletes use almost 85% of air being used by the active lungs, almost which is 5100 ml of air being used, and the dead space is just 15%. It means only 900 ml being exhaled without use, but it was doubled in normal individuals. You can see that it is 30%. Please go through the given images, and the resting heart rate of these athletes is just 50 to 60 beats per minute. Same way, I have given abnormal pathophysiology with chronic smokers having chronic obstructive pulmonary disease having the same tidal volume of 6 liters. We can see that breathing rate, which is more, as well as the resting heart rate, which is more. It becomes much more in critically ill patients with less survival rate having very large dead space. You can see very high breathing and heart rate. You can see that. So the Genong book is talking about the tidal volume being the same in normal individuals, athletes, chronic smokers and critically ill patients, and nothing much being talked about the dead space which is the most important fact. Having the same basic reason, dead space could be designed by the delivery itself, especially those babies with per-vaginal delivery having smaller dead space than those babies delivered by cesarean section. So that is the hidden fact, and so no medical books are talking about that. Now we'll go to the very interesting adulthood types of two different physiological lifestyles. This is a practical one. One group being cool with no stress, we will call this group as Shrivalli group, and the other group being mentally oriented with lot of stress, called as Pushparaj group. Shrivalli usually has decreased respiration routinely, with their medulla oblongata activating parasympathetic nervous system routinely, which is releasing acetylcholine with the sinoatrial node, which is called as SAN, to decrease the heart rate. Whereas Pushparaj has increased respiration during routinely, which is activating the sympathetic system to release noradrenaline, and that activates the sinoatrial node, which increases the heart rate. So my question is, which group will have more heart attacks and heart problems? I think even children would know that our Pushparaj will have the trouble. Think that Pushparaj had heart attack and treated with surgery or stent, whatever. And most of the doctors then what they do advise, they advise to do exercises. Is that right? Real truth is that long respiratory training by any sort changes the entire physiological background, including cardiovascular system, central nervous system, and even gastrointestinal as well as the renal system, and also our entire life. Many of us don't know how we are, because for everything now we need evidence-based medicine. Now if you are through this evidence-based medicine, pulse oximeter is needed to assess your resting pulse rate and SpO2. This because we want to know whether you are in sympathetic tone or parasympathetic tone, or you are equivocal. Very easy to say you are sympathetic tone. You are in sympathetic tone if you are hypertensive before you are 40 to 50 years of age, or have features of metabolic syndrome like elevated bad cholesterol, or diabetic, or you are highly obese. Same way to say as parasympathetic tone if your basal heart rate is less than 70 beats per minute and you don't have any of the above like diabetes, hypertension, or cholesterol, or heart problem, and always have instant sleep. Why I am saying this? Because if you are in high sympathetic tone, please go through breathing exercises routinely for months to years to have proper good results, and please don't rely on stressful exercises which might harm you, especially without doctor's advice. I will repeat again, breathing exercise is a must for those with their basal heart rate of more than 80 beats per minute, who usually have increased basal respiratory rate of more than 15 beats per minute. If your nature or work is stressful, please go to breathing exercise, especially if you're hypertensive or have cardiac troubles, and or might sometimes have irritable bowel syndrome, which is a relative indicator of your temporary or active stress. If you're sympathetic, go for breathing exercises. Who is having fight or flight mode? I mean, you are one of the fellows with high tension. But if you are a jolly fellow in nature with no stress, you can try whatever you want. Okay, from 2014 to 2020, I have been going to gym routinely at least 4 to 5 days a week, but couldn't reduce my weight, especially the love handles. I mean the bulky fat on the sides of the waist. All of a sudden, what happened? Gym was closed due to our COVID pandemic. Due to the COVID fear, I started doing breathing exercises for almost 30 to 45 minutes every day during our WhatsApp group. And within 3 to 6 months, I started seeing that love handles being melting down. It was a good surprise. After this, I forgot going to gym where we hike our pulse rate and breathing rate, which is shooting about BP, and the trainers in the gym, they would be very happy to see such results because everybody wants immediate results. But even in our breathing exercises also, we can give immediate results. Let's try. So here you can try. First, have your pulse rate. See your pulse rate. Now start doing controlled conscious breathing exercises. Breathing just like that, with long, slow inhalation and exhalation for at least 5 minutes. And please don't count your breathing rate. Okay. Now I'm sure your pulse rate would have definitely come down. At least if it has been 85 beats per minute, then you would have come to It's 80 beats per minute. I'm saying that if you want your immediate results, this is the way. In long term, your results would be much more than expected, I'll say. Initially, I gave two questions during our birth. Now, as an adult, this is the third question. What is possible voluntary control? Whether it is the heart rate or respiratory rate or peristalsis or body temperature. Everybody should know all the four are controlled by our autonomic nervous system, and the answer is very simple and straightforward. It is the respiratory rate, which you can easily control because I gave the answer before the question. Many of us also know that by controlling our respiratory rate we can control our heart rate. That means when you decrease your respiratory rate you can also decrease your heart rate, indicating you can control both respiratory and heart rate. I had been going to gym for almost 5 to 6 years with no very good results. I am also sure that many people might have such poor results like me because the basics is different. If you are in such gym environment with poor results, please change your lifestyle and learn to know about the breathing exercises taught either by well-known online groups or by yoga groups or special physiotherapy groups. Now I am giving my fourth question. What is the major muscle for respiration? Is it the diaphragm or intercostal muscles or pectoralis muscles or abdominal wall muscles? All might be involved during breathing at different circumstances, but the main and the major one is the diaphragm. I had seen many bodybuilders restricting the diet and even water intake routinely or during some circumstances. The same way, we have to be very restrictive about the time and volume of food intake, which might hamper our diaphragms. When the diaphragm is not at all in trouble, we will not have any cardiovascular disease, and that's the fact. We don't need recent articles to prove that, which is the basics. Now I am coming to those who are otherwise normal. Okay, not a smoker, have no BP, no diabetes, no big issues. They say I am normal. Again, we'll go to the normal and abnormal respiratory physiology now to see their respiratory and heart rate and the dead space respectively. If you are in normal or subnormal group by your basal heart rate, example, if your basal heart rate is 80 beats or above in an adult, you might be subnormal. Okay. If you're overweight and you're always overfeeding every day with stress, if you're overweight and you're always overfeeding every day with stressful lifestyle, you see your basal rate of more than 80 beats per minute. I'm sure you are subnormal. You can compare the basal heart rate of normal individuals with the basal heart rate of athletes. The difference is 10 to 25 beats per minute. The same thing with the normal and subnormal group, the difference being 10 to 15 beats per minute. If you start doing breathing exercises, your results might change within few months to 1 year or more. Whatever I have been talking, by this time you might know that you are in sympathetic tone or in parasympathetic tone. I have been so many doctors with tensed environments and have poor sleep, and these doctors tend to go to gym routinely to stress more. Only few doctors I know have no metabolic syndromes with instant sleep who are having basal heart rate of less than 70 beats per minute. I have seen only few doctors with good results. I am a radiologist already having the comparative results from being to the gym and then shifted to do breathing exercise, and you saw the results. Then I started knowing similar results or facts from an anesthetist and an orthopedist who also had similar results. If anybody else has such results, please, I am happy to know that by your comments. You know that there are 100 types of breathing exercises, but we need 10 to 15 are enough for practice. Most of our doctors are stressed normal people, either going for aerobic or anaerobic exercises regularly or irregularly with lot of troubles. They will have tensed pulse rate with lot of anger. Their food intake is more than usual, and this cycle becomes vicious. And now breaking everything is possible only with breathing exercise for 30 to 45 minutes every day. I am sure you will see enormous change. Already I told that breathing exercise changes everything. I am giving an article which says deep breathing exercises have been positively changed the biochemical parameters in chronic kidney disease patients. I am very happy to see such proven facts being published in this decade. I am giving the final touch of talk. I want everybody to be very well. Always take care of yourself. Sometimes be at rest. Always sleep well. And finally, be conscious with your breathing, because if you love breathing, miracles are always ahead. You can see the known facts of conscious breathing in this picture. If you have time and interest, please pause this video and learn more about the given benefits. Okay, now I'm back to the first football jolly video clip again. Go through that clip and try to know who is the central nervous system and who is the respiratory system and the cardiovascular system. I'm definite you know the answers. The kicker is the respiratory system who did the kicking. The presence of the lady is the central nervous system, and the jolly man who is happy to see the girl is the cardiovascular system whose head being hit by the ball and then the ball goes to the goal. Everything is in positive end, okay? Even here all are happy holding the jolly man, though the kicker and the lady are also very important for the goal, right? Here I am talking proudly because of my results before COVID and after COVID. I already talked about the loss of the love handles, I mean the loss of more fat on the sides of the waist. Here I couldn't give visual results to prove myself, but instead now I am giving more positive results, uh, which I had been doing during my gym practice. I used to do handstand with wall support, and then you can see that during COVID, after practice for 1 year by breathing exercise, I could handstand for few seconds without any wall support. That you can see that. Yes, is it not impressive? Last few seconds of last recap. First discussion was with facts and figures. I talked our birth and diving reflexes with fluid to air concept. It's the fact that we survived due to the central reflexes from cardiovascular system and central nervous system to make us breathe in this aerated atmosphere. That's the first strong fact to say that lungs is life at birth. Second discussion with facts and figures, I talked about the Ganong's medical physiology and said that nobody talks about the dead space. It's the easy fact that we can change our dead space in the lungs from childhood to old adulthood because we always have large dead space from birth to old age. Third one with sympathetic and parasympathetic nervous system connections by comparison of Srivalli and Pushparaj groups and the discussion finally touching that breathing is the main key to sort the problems. Now I conclude, deep breathing decreases our heart rate, blood pressure and the risk of coronary artery disease because breathing changes everything. Thank you very much for your patient hearing. Please click the like button and give your feedback in the comment section. Don't forget to subscribe the channel and please share this group to your friends and relatives who may not be doctors but still may be helpful. Take care and bye bye.